Good morning. So first of all, thank you to Dr. Kim for the invitation, as well as to Yidin Kim for being such a gracious host. Thank you to the hospital and everyone here for coming to listen to us talk. So it is a very big honor for me to be here and to have this opportunity to share some of the work that we've been doing at Rutgers. So I'm Dr. Sungwoo Kahng. As mentioned, I'm a professor at Rutgers University, and my expertise is in applied behavior analysis, or ABA. I've been working, the vast majority of my research has focused on assessing and treating individuals with autism and their problem behaviors and their complex problem behaviors. Just to give you a little background about how I got to this point, when I was an undergraduate student in college a very, very long time ago, I did an internship at the Kennedy Krieger Institute in Baltimore. The Kennedy Krieger Institute is a hospital for children with developmental disabilities, and they have an inpatient unit called the Neurobehavioral Unit, or the NBU. And so I was 21 years old. That was my first experience working with anyone with developmental disabilities, let alone anyone who engaged in very severe self-injurious behavior. So I very distinctly remember the patient, the very first patient that I worked with was, I think, 15, 16 years old. He had intellectual disabilities, autism, did not speak, and he engaged in very, very severe self-injurious behavior. So he hit his head on the back of his head, and he did it with such force and such frequency that he was bald in the back of his head there. And so as a 21-year-old college student, I had never seen this in my life before, and so I was very surprised and very shocked that there were people like this who would engage in such dangerous behavior. But I was also very surprised and very impressed that there was this treatment or this technology called applied behavior analysis that could help this person to stop engaging in that very severe self-injurious behavior and live a safe and hopefully happy life there. And so that started my journey into the field of applied behavior analysis to the point where I am now. And so over the years, I've moved around a couple of places: Kennedy Krieger Institute, the University of Missouri in Columbia, Missouri, and now Rutgers University in New Jersey. And so at each of those places, I've continued to be involved in both research as well as clinical treatment of individuals who engage in these complex problem behaviors. So what I'd like to do today is to provide just a broad overview of problem behaviors. Today I'll talk about the causes of problem behaviors, as well as how we go about behaviorally assessing these problem behaviors. And I will leave it up to Julia to do all the hard work and teach you all the different assessments, as well as treatments there. And so, as I've mentioned, the vast majority of my research has focused on these complex problem behaviors. And so we've evaluated behavioral assessments to try to understand why these individuals engage in these very dangerous behaviors. But then we've also engaged in conducted research to evaluate how to treat and reduce these very dangerous problem behaviors there. And so these complex problem behaviors that I'm talking about, behaviors such as self-injurious behavior, or SIB, aggression, and property destruction, they cause lots of problems in the individual's lives. So for example, they impede or interfere with the individual's ability to learn. So whether it be to learn how to communicate, learn how to brush your teeth, learn how to put on your clothes, these problem behaviors will interfere with those types of very important skills. For older individuals, so for particularly adults, these complex problem behaviors will interfere with it interferes with vocational or employment opportunities. So individuals who engage in these very complex problem behaviors oftentimes cannot get jobs in the community where they can get paid, have a social experience, and interact with other people there. And it could also interfere with the individual's ability to go to school. So if the individual is engaging in very severe self-injurious behavior or aggressions, the schools will oftentimes not want them in their classroom or in their building there. The other thing is that it also results in adverse health consequences. So there's injuries that are associated with self-injurious behavior. There are injuries to other people associated with aggressive behaviors there. And it also restricts the individual's opportunities to engage in social interactions with other people. So they can't make friends, they can't interact with other people. And it may also limit their ability to live in the community. So they may have to live in larger institutional type environments as opposed to in more like home-like situations. And then finally, particularly in the United States, once these individuals turn 21, they no longer go to school. And at that point, they lose a lot of supports and a lot of access to services there. So even though they continue to have autism, they continue to engage in these problem behaviors, once they turn 21 and they leave school in the United States, many of the services and supports they had been receiving are gone. So fortunately, research has demonstrated that one of the most effective approaches to supporting these complex problem behaviors exhibited by people with autism is through treatments based on applied behavior analysis, or ABA. And so just to provide you with a brief overview of what ABA is, it is the process of applying sometimes tentative principles of behavior to the improvement of specific behaviors and simultaneously evaluating whether or not any changes noted are indeed attributable to the process of application, and if so, to what part of that process there. To put it more simply, I describe ABA as the application of behavioral science to improve socially important behavior and to improve the quality of life of individuals, families, and communities. And it helps us to understand why an individual engages in these specific behaviors, how the behavior is affected by the environment, and how learning takes place. So I want to emphasize that ABA is a science. And it's a science that has been around for quite some time. The conceptual foundations date back to the 1900s, where we have individuals like Thorndike, Watson, Pavlov, and Skinner. But our applied research dates back to the 1950s. And thus, ABA is an evidence-based treatment approach recommended by multiple, at least in the United States, multiple governmental, scientific, and professional organizations. Now, in order to characterize, the characteristics of ABA include several factors. So the very first thing that we do, and that Julia will be talking about, is that we develop objective and reliable measurement systems. So when we know that someone engages in self-injurious behavior, we will describe what that self-injurious behavior looks like, and we will develop a system to directly measure that behavior there. And so we talk about this in terms of operational definitions, as well as direct observation of these behaviors there. Then our next step is to identify what we refer to as the environmental determinants of behavior. Essentially, why is the individual engaging in these complex problem behaviors? What is the cause of these complex problem behaviors? And as behavior analysts, we look to what we refer to as reinforcement contingency. So behaviors are controlled by the antecedents as well as the consequences for these problem behaviors. And the consequences we refer to as reinforcement. And then once we've determined what the cause of the behavior is, then we will conduct a very rigorous treatment evaluation to identify the most effective treatment for these problem behaviors. So I also want to emphasize that ABA, I mentioned that it is a behavioral science, and it's a behavioral science that's applied very successfully to support people with autism. But I also want to emphasize that ABA has been used to improve lots of other areas of society, right? So developmental disabilities and autism is a very important area of ABA, but there are behavior analysts who work with like large corporations to improve safety. There are a lot of behavior analysts who work in school systems with, let's say, younger kindergarten students to improve performance in the school system there. We have behavior analysts who work with older adults, senior citizens, who may have dementia to help support those individuals' behaviors. So those are just a few examples of how ABA is used across a variety of different populations and behaviors to help to make meaningful improvements in their lives. So now I'm going to focus on ABA and autism and how ABA is used to support people with autism. So when ABA is used to support autistic people, the focus is on helping to develop new skills and to reduce more problematic behaviors, these complex problem behaviors. And so we know that decades of research has shown that one of the most effective approaches and treatments to supporting people with autism is applied behavior analysis, or ABA. Right, so again, research clearly supports that applied behavior analysis is one of the most effective treatments for supporting people with autism. And so just to give you an idea of this research, and all the research that's out there, at least this is all related to the United States. The abundance of research has led to the endorsement of ABA-based interventions for autistic people by many organizations, so by the government, by scientific organizations, and professional organizations there. So for example, in 1999, a long time ago, the U.S. Surgeon General's report on mental health, the U.S. Surgeon General is considered the top doctor in the United States. They stated that 30 years of research demonstrated the efficacy of applied behavioral methods in reducing inappropriate behavior and in increasing communication, learning, and appropriate social behavior. So keep in mind, this was all the way back in 1999. Right, so that's 25 years ago, so it's a very long time. And this was a report by the U.S. government, the U.S. Surgeon General there. More recently, we've seen similar endorsements by many scientific and professional organizations. For example, in America, it's the American Academy of Child and Adolescent Psychiatry, the American Association on Intellectual Disabilities, and then finally, the American Academy of Pediatrics. So it's the American Academy of Pediatrics is the largest professional organization for pediatricians in the United States. And so the American Academy of Pediatrics published a report several years ago. And in that report, they stated that most evidence-based treatment models are based on principles of ABA. And they also stated that the use of ABA methods to treat symptoms of ASD autism suggests that behaviors exhibited can be altered by programmatically reinforcing skills related to communication and other skill acquisition. Right, so this is the largest pediatrician organization in the United States that is saying, based on all the research that exists, ABA is one of the most effective treatments in supporting people with autism. And so what I'd like to do is to just provide you with some examples of these complex problem behaviors. I'm sure that many of you in your regular day-to-day jobs are probably experienced and interact with your patients who engage in some of these problem behaviors, but I thought I would just kind of provide you with some of these there. And so these complex problem behaviors include behaviors such as self-injurious behavior. So very common examples of self-injurious behavior would be head hitting, head banging, where they're hitting their head against the wall or the floor, might be biting themselves, pinching themselves. Those are just a few examples of self-injurious behavior. And here's a video of a patient from Kennedy Krieger Institute who engages in very severe self-injurious behavior. And so what you'll see in this video, I apologize, it's an old video, so it's a little, the image quality isn't very good. But what you'll see, this particular patient, she was about 15 or 16 when she came into the hospital. And she came because she engaged in very severe hand-to-head self-injurious behavior. So what you'll see is that she is punching herself with both hands on the side of her face. And she would hit herself thousands of times a day without any type of, if no one stopped her there. So this particular individual, the only thing, if no one stopped her from engaging in this behavior, the only thing that she would do all day long is to punch herself in the face. And so you'll see that she's punching herself with both hands. She actually hit herself so frequently that she detached her retinas, so she's blind, or she was blind. And even when we put on a helmet and other protective equipment, she would still engage in very severe self-injurious behavior there. Okay? Now, another common behavior, or other common behaviors that we see are aggressions, where they are punching other people, kicking other people, trying to bite other people. And then we also see property destruction, where the patients might be throwing things, they might be punching holes in the wall, and lots of other damages to property there. So here's a video. This is from the University of Missouri. And this, I think he was 14, 15-year-old teenage boy, autism. He also had intellectual disability. He did not speak and didn't have any appropriate communication. And this was a situation where we're trying to get him to do some schoolwork. He lived in a very rural part of Missouri, so there weren't a lot of services. The public school that he went to had no idea what to do with him. He was very aggressive, also very self-injurious. In his school, they would put him in a large room by himself. There were two teachers' aides, staff people, who would stand by the door, and the two staff people would just leave him in the room by himself, not interact with him, not do any type of schoolwork because they were afraid of getting hit and injured there. And so here, this video, we're trying to get him to do some work, and it's a very simple task of coming to the table and sitting at the table, which he had never done at school. And so you'll see that this is me, and we're trying to get him to sit at the table. As soon as we approach him, he becomes very aggressive. You also see that we're wearing arm guards to protect ourselves, so to reduce any injury. You'll see that Annie, the colleague, is carrying around a pad, again, also to protect ourselves there. So we're just trying to get him to stand up and sit at the table. And so you'll see he's trying to engage in property destruction, where he's trying to knock over furniture. And he actually bites his hands. And then he's throwing other objects there. Okay. All right. So that's the examples of aggression and property destruction. So just to give you an idea of how common this is, research estimates that anywhere from about 10 to 70% of people with autism engage in these problem behaviors. So it's a wide range, but the vast majority of people with autism will engage in some form of problem behaviors, like aggression, self-injurious behavior. Uh-oh. Is that okay? All right, I'll keep going. So the vast majority of people with autism will engage in some form of problem behaviors. Not all of these behaviors are as severe as the behaviors in these videos. So a smaller percentage of people will engage in these more severe types of behaviors there. Now, what we also find, research shows, is that there are certain risk factors that increases the likelihood that people will engage in these problem behaviors. And these include where they live. So people who live in larger institutional types of settings are more likely to engage in problem behaviors there. Also, the level of functioning. So people who have greater support needs, people who are minimally verbal or perhaps have profound autism, are more likely to engage in these problem behaviors. And then finally, research shows that males are more likely to engage in these problem behaviors than females. But that may also be because there are more males who are diagnosed with autism than females. And so what we see is that like these problem behaviors, these complex problem behaviors result in lots of like direct and harmful consequences, as well as lots of indirect consequences as well. So if we look at like the consequences of these behaviors, injuries. So direct consequences include injuries to themselves. So as I mentioned in that first video, the person who was punching herself in the face, she had punched herself so frequently and so hard that she detached her retina, and therefore, again, she had literally blinded herself by engaging in self-injurious behavior. So that's a very extreme example of the direct consequence. But we'll see, people who engage in that self-injurious behavior, or SIB, with lots of bruises, lacerations. We'll see, cuts, eye damage, and other types of injuries to themselves. For individuals who are aggressive, we'll see lots of injuries to other people, bruises to other people, cuts, bites to other people. I think the worst injury that I knew of was the daughter had broken her mother's leg. I think she pushed her, and the mother fell in a way that she ended up breaking her leg as a result of the injury there. So these are, obviously very harmful, consequences of self-injurious behavior and as well as aggressive behavior. But there are also other consequences that occur. So as I mentioned at the beginning of my presentation, people who engage, or individuals who engage in these complex problem behaviors are not able to go to school. They're not able to come receive other types of therapy or education or vocational settings. They're oftentimes not able to go into the community to experience everything else. Oftentimes also that people with these very severe complex problem behaviors are more likely to have to live in other, like outside of the home, in more institutional types of settings there. And then when they become older and adults, it is more difficult for them to move out of their parents' home into the community because no one in the community is able to deal with these and support these types of complex problem behaviors there. And then finally, what we see is that people who engage in these complex problem behaviors, they'll oftentimes use physical and chemical restraints. So patients with these problem behaviors may be restrained so that they don't hurt themselves, or they may be very heavily medicated so that they don't hurt themselves there. And then finally, as I mentioned early on, once in the United States, once they turn 21 and they no longer go to school, they lose access to a lot of the supports and therapies that they had received when they were younger children. And so again, they lose out on opportunities for therapeutic activities as well as going into the community. So the question then becomes, why do people with autism engage in these complex problem behaviors, right? So as I mentioned, my first experience was with that teenage boy who engaged in that very severe self-injurious behavior, and I had never seen anyone hit themselves so hard that they, and so frequently that they were bald in the back of their head. And so that is one of the, there's quite a bit of research within the field of ABA designed to identify why people who engage in complex problem behaviors engage in these behaviors there. And our research shows that the best way to treat these complex problem behaviors is to first identify what the cause of these problem behaviors are. So once we know why they're engaging in these behaviors, we're then able to develop treatments based on that information. So we're able to create individualized treatments to help support and reduce these problem behaviors. So this whole idea of trying to identify why or the cause of these problem behaviors is based on antecedent behavior and consequence contingency. So we refer to this as the three-term contingency. And so what we're looking at is what the antecedents are that precede the problem behavior. So what happened just before they engaged in aggressive behaviors there? And then what we're also interested in is what happens immediately after the problem behavior occurred, and that's what we refer to as the consequence. So the ABC contingency is the antecedent, what happens before the behavior itself, the B is the behavior, and then the C is the consequence, what happened after the behavior there. And so research shows us, has shown us very clearly that this three-term contingency, this antecedent behavior consequence contingency, is how we can determine why these individuals engage in these problem behaviors there. And so here, what we're talking about is what we refer to as the functions of behavior. All right? And what we find is that these behaviors are learned behaviors. Again, so I want to emphasize that these behaviors are learned behaviors. All right? So over time, these individuals with autism will learn to engage in these behaviors. And so the individuals learn these behaviors as a result of their contact with their environment. So how we treat, how we interact, or how we respond to these behaviors will result in how they learn to engage in these problem behaviors. And just to kind of show you a little bit of how we got to where we are now, in the late 1960s, Ivar Lovaas showed us that self-injurious behavior could be reinforced by attention. So what he found is that when someone engaged in self-injurious behavior, and that self-injurious behavior was followed by attention, right? So a reprimand. So, for example, somebody hit themselves, and then someone would say, "Don't do that, you're going to hurt yourself." That attention was a reinforcer for problem behaviors. So that meant that attention resulted in the self-injurious behavior occurring more often. In the mid or late 1970s to early 1980s, Ted Carr and Mark Durand showed us that aggressions could be maintained by escape from demands, right? So that individuals can learn that when they engage in these aggressive behaviors, they don't have to do things that they don't want to. They don't have to do schoolwork, they don't have to do chores, and those types of things. So they learn to escape these unwanted activities there. Okay, so Lovaas showed us that attention can be a very powerful reinforcer for problem behaviors. And Carr and Durand showed us that escape from demands can be a very powerful reinforcer for problem behaviors. And then in 1982, Iwata and his colleagues published a study that presented a behavioral assessment for how we can identify what the reinforcers or the antecedents and the consequences are for problem behaviors there. And that's what we refer to as a functional analysis. So again, I want to emphasize that research tells us that these are all learned behaviors. So that they're not born engaging in these problem behaviors. They're not engaging in these problem behaviors because they have autism. They engage in these problem behaviors because they learn to engage in these problem behaviors. And this makes a lot of sense. As adults, we do lots of different things, to calm our children down. So I have my son is 17 years old now. He's taller than me. And when he was very young, if he wanted something, he wanted a toy, or if he wanted to go somewhere, before he could really talk, he might cry, he might, whine a little bit, he might, point to things there. And those are all ways in which, he learned how to get what he wanted before he learned how to speak there. And it's the same thing with people with autism, right? That people with autism may not necessarily be able to speak and appropriately ask for things. And so they will learn that when I engage in aggressive behaviors, I get things. I get attention. People allow me to stop, having to do work. I get my favorite toy. I get to go to the playground and things like that. And so basically what happens is that over time, the individuals learn that when they engage in these complex problem behaviors, these behaviors will produce reinforcement, that they will get something that they want. And so common examples would be what we refer to as positive reinforcement, where the kids are receiving something is being presented to them when they engage in problem behaviors. Another example, like probably the two most common examples would be attention, as well as access to tangible items. We refer to access to tangible items. So if you think about it, if a parent sees their child hitting themselves or hitting other people, what is the most likely thing that the parents will do? Most likely the parents will say, don't do that, you're gonna hurt yourself. Why are you hitting yourself? Stop doing that. You're gonna hurt me, stop doing that there. As a parent, that makes complete sense, right? As a parent, I want my child to learn that is not appropriate for them to, hit me or hit themselves to get things that they want. Unfortunately, for people with autism, they may not necessarily, they don't grow out of this. So they don't oftentimes learn more appropriate ways to get attention. And so the easiest way for them to get attention would be to be aggressive or engage in self-injurious behavior. So again, if you think about it, if you see a child engaging in self-injurious behavior or aggressions, the parent will most likely run over, start hugging them, start comforting them, trying to get them to stop. But unfortunately, that oftentimes ends up doing the opposite of what was intended and will actually make the problem worse. A similar situation would be access to tangible or like more preferred activities, toys, games, going out and playing. And so again, oftentimes what we see is that if a child is engaging in self-injurious behavior, the parent or teacher might give them toys to try to calm them down, to try to interrupt the self-injurious behavior. Again, that makes lots of sense, right? Like they're trying to get the child to stop, but unfortunately, what the autistic child is learning, or the individual is learning, is that when I hit myself, my mother, my father, my teacher will give me something that I like, so that the next time I want a toy, I need to hit myself to get that toy there. All right. So again, hopefully that gives you an idea of how individuals with autism will learn to engage in these problem behaviors there. Now, another type of consequence or reinforcement will be referred to as negative reinforcement. So what this means is that when they engage in these problem behaviors, something that they don't like, something undesirable is being removed. And the most common example would be escape from demand, so schoolwork, right? So perhaps the person is at school. It's a teacher. It's a wonderful teacher. The teacher is trying to teach them how to, do some like math problems, let's say. But the child, let's say, is very tired. Right? It's a long day. They don't want to do any more work. Perhaps it's really, really difficult, and they don't understand what the assignment is or what the demand is. And so perhaps they push the materials away. All right, so I don't want to do it, so they just kind of push it away. The teacher, is a wonderful teacher, and so the teacher will persist and try to continue to engage the student to get them to learn. And then so the push might become a harder push, and then an even harder push, and then perhaps the push accidentally becomes hitting the teacher there, right? And the teacher is very, very surprised because the student has never hit them before, and so the teacher might say, okay, looks like you're very upset. Looks like you need to take a break, so let's take a break, give you time to kind of cool off and rest a little bit, and then we'll come back to it later there. Again, from the teacher is doing an amazing job trying to get the child to be calm and not engaging in these problem behaviors. But again, unfortunately, what the child is learning is that when I hit my teacher, when the teacher asks me to do something in school, and I hit the teacher, I no longer have to do that schoolwork there, right? So the child has learned that when I am aggressive, I don't have to do things that I don't want to do. Right? And I want to really reiterate the fact that no one is intentionally teaching these behaviors to the children, right? Like no one is trying to teach someone to be aggressive. No one is intentionally trying to teach someone to be self-injurious. We are unfortunately inadvertently teaching these children, these individuals to engage in these problem behaviors there. So we have good intentions, but unfortunately we end up making things worse by providing the attention, access to their favorite things, or like allowing them to escape from things that they don't want to do there. The final, what we refer to as functions of the behaviors, what we refer to as automatic reinforcement. And this is this is different there. There are some individuals who engage in really very severe self-injurious behavior because they get some type of internal stimulation there. So it doesn't matter if I give them attention, it doesn't matter if I give them their favorite toy, it doesn't matter if I give them a break from schoolwork, but it's something that when they hit themselves in their head, something is happening, and perhaps they get some type of relief, perhaps they get some type of interesting sensation, but it's referred to as automatic reinforcement. So the behavior itself is producing that reinforcement or that stimulation there. Okay. Now, it's also important to understand that these are all just very broad categories. So I'm providing you with these examples that are just probably the most common examples, but these aren't the only examples of why individuals engage in problem behaviors. There might be more, I guess, idiosyncratic or unusual reasons why, still tied to how we respond to them. But again, but the point is that these are all learned behaviors there. Okay. So the learned functions of these behaviors, like once we know why these individuals engage in these behaviors, so again, what the cause of these behaviors are, it allows us then to identify and develop a treatment plan, right? And so it's very important for us, as a part of this whole treatment development process, to identify the behavioral function, because that really it turns out to be a roadmap for how we go about developing individualized treatments for these individuals. And so in order to identify and determine like what the cause of the behaviors are, we will use what we refer to as a functional assessment. We'll use a set of behavioral assessments that we refer to as functional assessments, or sometimes in the schools in the United States, they'll refer to them as functional behavioral assessments, or FBAs there. So the functional assessments are a process by which this functional relationship, this cause and effect relationship between the problem behaviors, or the complex problem behaviors, and the environmental events, the antecedents, the consequence. The functional assessment is used to identify the antecedent behavior and consequence relationship there. Okay, so the functional assessments allow us to identify like, what are the antecedents that are triggering the problem behaviors, and what are the consequences that are reinforcing the problem behaviors there. So the goal of conducting a functional assessment is to identify, again, the events that evoke or elicit the problems and the consequences that maintain the problems. All right. Now, the variables that maintain the behaviors are not necessarily the variables that are responsible for the establishment of these behaviors there. All right. So I mentioned earlier that early on when the children oftentimes are young, basically what we're doing is we're shaping or teaching the children to engage in these behaviors. But these behaviors over time may change. So it could be that early on attention is a very powerful reinforcer for self-injurious behavior. But as the individual gets older and older and older, they may learn other benefits of engaging in these problem behaviors there, right? So they may learn that, not only do I get attention for engaging in these problem behaviors, but I can get other things that I want. My favorite activity, my favorite food, they might learn, not only do I get attention, but I can also use this behavior to not do things that I don't want to have to do there. Okay, so the functions of the behavior can be fluid, and they can change over time depending on how we and their caregivers respond and interact with these problem behaviors there. Now, I mentioned that it's not uncommon for young children to engage in like tantrums, other whining, maybe a little bit of aggression, right? So when kids are younger, they oftentimes will engage in these behaviors. So I'll use an example in the grocery stores in the United States. When you go to pay at the checkout register, you'll see candy like all along the side over here. And you see oftentimes that there's a little kid who's asking their mother or their father for the candy. The parents don't want to buy them the candy, and we might see that the little child starts to cry and tantrum to get the candy. And then the parents will, just because they're embarrassed, they want to get out of there, they'll just, they'll buy the candy there. Right? So that's an example of how in everyday life, we might reinforce these inappropriate behaviors in even children without autism there. Now, the difference is that, the neurotypical child or the child without autism will eventually learn other ways to get what it is they want, right? So they go to school, they talk to the parents. They'll start learning that, hey, I can just ask to talk, for these things. I can just walk up to my parents and give them a hug and get that attention there. I can just tell the parents that I'm very tired and I need to take a little nap there. All right, so neurotypical or kids with autism will eventually learn the more adaptive and more appropriate skills there. But what we find is that the autistic students may not necessarily learn those same skills in the same way, right? So, and that's why we need more intensive supports to teach these individuals with autism the more appropriate ways to gain access to attention, their preferred items, and so on there. And so it's most likely the case that autistic individuals will, experience these opportunities to get things that they want, and that they will more oftentimes have opportunities to engage in these problem behaviors to get what it is that they want. Because in many situations, the only ways in which that they can get things that they want is by engaging in these problem behaviors there. So if you think about, let's say, a classroom. In a school might have 20, 25 students, one teacher, maybe one aide. And so the teacher is very, very busy. They can't attend to all the children. But the kids who are most likely to get a lot of the attention in the classroom will be the one who's probably the most disruptive, who's probably aggressive, who's probably self-injurious. And so the teacher will most likely go to that child versus the other 24 students who are sitting very quietly, working, maybe playing very nicely and things like that. Okay. Now, I mentioned that knowing what the function or the cause of the behavior is important, integral to determining what the treatment is. And so we do that again through the functional assessment or the functional behavioral assessment. And the functional assessment is actually 3 different types of assessments there. It's what we refer to as an indirect assessment, descriptive analysis, and the functional analysis. Very quickly, the indirect assessment is simply a very short questionnaire. So it's a caregiver report. There's several examples like the FAST, the QABF. And so it's really simply asking the parent, for example, questions that might point to that it's attention maintained, escape maintained, and so on there. Research shows that those instruments or those tools are not very good at predicting the functions of behavior. They might be good to gather just some background information, but as a sole tool for determining the cause or the function behaviors, the indirect assessments like the FAST and the QABF are not good tools for that. The descriptive analysis would be a little bit better. It involves direct observation. So we are directly observing the child just in the classroom, at home, in the regular environment, and we're simply observing what are the antecedents, what's happening before the behavior occurs, and what's happening after the behavior, the consequence, after the behavior occurs there. And so what we're looking for is a correlation between the antecedents and the behavior and the consequences. So if we find that in most cases, whenever the behavior occurs, the parents give a lot of attention, that might suggest that attention is a reinforcer for the aggressive behaviors there. Descriptive analysis is better than indirect assessment, but it's still not perfect there. The final assessment is the functional analysis, which is what Julia will talk about today. The functional analysis is the most powerful tool that we have for identifying the function of the behavior. Right? So the functional analysis allows us to determine that cause and effect relationship. And so we're able to identify and confirm that attention is the reinforcer for problem behavior, that the escape is the reinforcer for the aggressive behaviors there. Just to very quickly talk about the functional analysis, and I'm not going to spend a lot of time because Julia will spend more time on this. The reason that the functional analysis is the most powerful assessment that we have for determining function is that we are actually changing and controlling what those antecedents and the consequences are. So we are exposing the individuals to situations in which we present demands and allow them to take breaks when they engage in problem behaviors. We are exposing them to situations in which we aren't giving them a lot of attention, but we'll give them attention if they engage in problem behaviors. We're exposing them to situations in which they have to put their toys away, they have to stop doing their favorite game or favorite activity, but if they engage in problem behaviors, they get those things back there. So we're controlling what the antecedents and the consequences are, and we're repeating those over and over and over again until we see a pattern, and that will then allow us to know that, yes, it is attention that is a reinforcer for problem behavior, or it is access to toys or really preferred foods to engage in these problem behaviors there. So the functional analysis, again, is the most powerful tool we have, but it also requires a lot of technical expertise. So I think oftentimes people are very intimidated by conducting a functional analysis, but it turns out it's really not that hard to do as long as you have some sufficient training. Just to give you an idea of all the research, there are hundreds of studies that have shown that the functional analysis is a very effective tool for determining behavioral function. This is a study done a while ago where they reviewed functional analyses for 152 participants or patients. I think they were both adults and children. And they showed that this functional analysis was very effective in identifying what the reinforcer or the cause of the behaviors were. So in many cases, the causes were escape from demands that they learned that they didn't when they didn't want to do things that they would engage in self-injurious behavior. If they wanted access to certain things, whether it be attention or like favorite toys and games. The sensory would be that automatic reinforcement that I mentioned, so that if they engage in really severe self-injurious behavior and they're getting some type of stimulation there. And then there's also like combinations, right? So we might have some children who engage in these problem behaviors because they learn that they not only can they get attention, but they can also get their favorite toy or their favorite snack when they engage in these problem behaviors as well. Right. So this study was a really nice study because it has a lot of subjects, and it highlights really like the utility and the importance of conducting functional analyses to determine the cause or the functions of the behavior there. Now the antecedent conditions, the reason knowing the function is so important is there's really three reasons. One is that, again, looking at that ABC contingency, the antecedent behavior consequence contingency there, once we know what the antecedents are that trigger these behaviors, we can then modify those antecedents to prevent these behaviors from occurring there. All right, so for example, if we know that attention, when they're alone, there's no one around and they don't have a lot of attention, that deprivation from attention, so if we have that information, then we can develop a treatment, which I'll talk a little bit more about tomorrow, where we make sure to give them lots of attention, free attention early on, so that they're not motivated to engage in aggressive behaviors there. Now, the other reason why the functional assessment and knowing the function is so important is that once we know what the consequences are, right? So once the reinforcers for the problem behaviors are, we can then, for example, start teaching them more appropriate functional communication responses to get what it is that they want. So if they've learned that when they're aggressive, they will get their favorite toy or they will get their favorite snack, we can then start teaching them more appropriate ways to get their attention. So perhaps it's saying, excuse me. If they can't speak, perhaps it's raising their hand, handing a picture card, and so on and so on. And then finally, once we know what the reinforcer or the consequence for problem behavior is, we can then make sure that they no longer get that same consequence for problem behaviors there. Right? So if we know that attention is maintained by attention, right? So they engage in attention, they get the attention, next time they want attention, they engage in the aggressions, then we can make sure to start teaching the parents and the teachers to stop giving them attention when they engage in aggressive behaviors there. So we refer to that as extinction. ultimately the goal is, and the purpose of this is, when we conduct a functional analysis, is that it guides individualized treatment. All right, and I want to emphasize individualized treatment. So as you all know, every single child and adult that you work with autism is very different from one another. And because they're so different from one another, we need to make sure that we individualize the treatment specific to the needs of that one patient. So we may have two people with autism who are nonverbal, perhaps have profound autism. They both engage in self-injurious behavior where they engage, where they're punching them in the side of their face. But the reason why they do that could be very different. One adult can engage in hand-to-head self-injury because of that attention. Another child can engage in that hand-to-head self-injury because of the sensory stimulation they're getting. And so the treatment for one will be very, very different than the treatment for the other. And so again, we emphasize the individualized treatment. And research shows that when we take this function-based or this individualized approach to treatment development, that treatments based on the cause, right, why they're engaging in these behaviors, tend to be more effective than those treatments when we don't know what the function is, which makes sense because when we don't know what the function is, we are essentially guessing as to what treatments we should be testing there. This is a review paper that we published a long time ago now, and one of the questions that we asked was how effective are treatments when they're based on that functional assessment? So we know what the function is, we know what the cause is, and we develop that individualized treatment versus treatments that weren't based on that functional assessment. So essentially we were guessing. So this is a review of published research on self-injurious behavior. And what we found is that the highlighted studies, that those studies that were based, or those treatments that were based on the functions of the behavior tended to be more effective, so they reduced the behaviors to lower levels as compared to those treatments that were not. So just to summarize, when we use this ABA approach to assessment and treatment, it allows us to create a behavioral assessment model in which we use, in which we first identify and directly measure those complex problem behaviors. So we create those operational definitions, and then we develop measurement systems in which we can directly observe these behaviors there. We then use that information to conduct our functional assessment to identify the antecedents as well as the consequence, that ABC relationship there, so that we can determine what the function of the behavior is. And then that information would then allow us to develop individualized function-based treatments to effectively reduce the problem behaviors there. Now, the goal of all of this is to increase the autistic person's opportunity to obtain reinforcement. So we want our individuals to be able to go into the community, to go into school, to come to your clinics and receive therapy for social skills, for communication. We don't want these complex problem behaviors to interfere with their ability to engage in these therapeutic activities. We obviously don't want the individuals to harm themselves or harm other people there. We want them to be able to go in the community and experience all the wonderful things in their environment there. And it is through this assessment and treatments that we're able to do this there. So I'm going to wrap up my part today by just presenting you with a case study, just to kind of show you, how we progress from the very beginning to the very end there. This individual here, let's see. I'm going to pause here. So this individual, he was 12 years old at the time. This individual is a 12-year-old boy. He's actually rather large for himself. This is also at the Kennedy Krieger Institute. So again, the video's kind of old and the image quality isn't very good, so I apologize for that. He engaged in very, very severe self-injurious, aggressive behaviors there. He was very high functioning, so he can have verbal skills are excellent. He can have a conversation with you, but he lived with his parents. His parents couldn't keep him safe, and they weren't safe. So he went to a residential school. So he went to school, and then he lived there. They couldn't keep their staff safe because of his aggressions, so they kicked him out of the school. And he moved to a different residential school. They couldn't support him, and their staff were unsafe, so they kicked him out of that school. It was at that point that he came into the Kennedy Krieger Institute because there were no schools and no residential placements that were willing or able to take him because of the severity of his aggressive behaviors there. So he engaged in very, very severe aggressive behaviors there. Here's a video. This is a situation in which he had to put his toys away. So he couldn't have something that he wanted there. I think these were comic books. As soon as he was told that he couldn't have something, he would start punching and attacking the person there to get what it is that he wanted there. Okay. All right, now this is another situation where we're trying to get him to do some schoolwork. So we want him to sit down, do some worksheets. But again, as soon as we presented that worksheet to him, he would immediately become aggressive there. Right, so Kylie, the therapist in this one, has that red folder, which is the schoolwork. As soon as she tries to get him to do something, he becomes aggressive because he has learned that when he doesn't want to do something, he can start becoming aggressive, and people will back away, and then they'll leave him alone there. Okay. The first video, he had learned that when someone doesn't give me something that I want, I can become aggressive, and they will give me what it is that I want there. Right. So again, these are examples of learned behaviors. So show you, just to kind of again highlight this whole process of how we got to where we ended up. This is the operational definitions of his behaviors there. So you can see we tried to be as descriptive as possible so that if some stranger were to see to read this operational definition and they saw him engage in his behaviors, they would be able to say, oh, that is his aggression, or that is his verbal aggression, like swearing and things like that. Okay, so we try to be as descriptive and thorough as possible in the operational definition. And then once we are able to identify what the behaviors are, we then develop a system to directly observe and measure the behavior. So it's very important for us to be able to directly observe and measure the behavior because that allows us to determine whether or not our treatment actually made a change in the behavior. So we'll have baseline data, so we'll see how often they're engaging in these behaviors without any type of treatment, so that's our baseline. Then we'll compare that to his behaviors during our treatment. So have we seen a reduction in the problem behaviors compared to baseline? And I'll show you his graphs in a second there. We then conducted our behavioral assessments. So we always do a functional analysis. So the functional analysis is where we are actually controlling what the antecedents are, so what we're doing before the behaviors occur, and then what we're presenting or what the consequences are after the behaviors occur. So that functional analysis is, again, the most powerful tool that we have in determining what the cause of the behaviors are. And so what we'll do with these data is to graph up all the data, and here's an example of his data, and what we're looking for is problem behaviors, in this particular case, aggressions, verbal aggressions and property destructions that are occurring more often in some of these conditions as compared to some of the other conditions. In this particular case, what we found for him is that attention was a reinforcer for his problem behaviors, access to things that he wanted was a reinforcer for problem behaviors, escape from demand in schoolwork was also a reinforcer for his problem behaviors there. The other more idiosyncratic variable was that what we refer to as a divided attention. So if there were two adults that were talking to one another and he was just there, he would become aggressive because he wanted them to talk to him and not to one another there. Okay, so that's a bit of a more unusual type situation there. So what we learned from our functional analysis is that there were many reasons why he engaged in his problem behaviors. The cause of his behaviors were multiple variables. There are multiple functions. And so we developed a treatment goal. Generally, back at the hospital, the goal was an 80% greater reduction in problem behaviors as compared to the baseline. And the treatment was really focused on addressing the antecedents. Right? So what we refer to as non-contingent attention. But the other treatment component was what we referred to as a my way, your way treatment there. What we found is that we worked on teaching him that there are certain times when he can do whatever he wants. We'll interact with him. He doesn't have to do any schoolwork. He could play with whatever favorite games are. But there are also times in which he needs to do things that we need him to do. So we needed him to sit down, do schoolwork. We need him to interact and talk with us there. We need him to put away his toys because it's time to go to school or do something else there. And so in that particular treatment, the My Way, Your Way treatment, what we gradually do is give him access to his way. So he can do things for the vast majority of the time that he's with us. As long as he's not being aggressive towards her or things like that, he can have a wonderful time, and we will be with him there. And then at the end of it, for a very short period of time, we'll need him to do things that we want him to do. Right? So it could be, let's say, in a given hour, 55 minutes, we'll do things that he wants to do, but then the last 5 minutes, he has to do things that we want to do there. Right? So putting his toys away, doing a little bit of schoolwork. And what we'll gradually do is to start switching it so that he has to do more and more of what we want him to do or what we need him to do. So it can become 45 minutes of his way, 15 minutes of our way, then 30 minutes of his way, 30 minutes of our way, 15 minutes of his way, and 45 minutes of our way there, right? So we make that a very gradual shift. And so what that resulted in, and I just want to highlight the end, is that you can see that early on he engaged in lots and lots of problem behaviors there. But at the end of it, the treatment resulted in a really, really nice reduction in problem behaviors, almost to the point where he never engaged in problem behaviors. And so this is kind of like the after video. And I do want to point out it took a long time to get to this point and a lot of work from the staff there. So this is with the parents and parent training, just a social interaction type condition there, social attention condition. And this is, I refer to this as our boring video, which is always good following treatment. We want our videos to be boring in treatment there. This is schoolwork, so getting him to do, I think, math worksheets maybe. And so, if you remember from that first video, as soon as we presented the math worksheet, he started punching the people. But now he's seated very patiently, doing the schoolwork, doing the homework with the parent there. So I do want to emphasize that I'm showing you these snapshots, right? So before and after, things were really difficult before. Things got a lot better afterwards, but there was a lot that occurred in between as well there. So he was admitted to the hospital for 3 months. The first 2 weeks or so is when we did all of our behavioral assessments, that functional analysis there. Our treatment evaluation took about 2 months, so about 8 weeks. And then the last month of his admission was focused on parent training, what we refer to as generalization of getting the child outside of the hospital into the naturalistic environment there. And so at discharge, we actually found a private school, a residential school that was willing to take him. It's been a while since I've been in touch with his mother, but the last I knew he was doing very well in school. He was going to class, he was learning, and he wasn't engaging in these problem behaviors or these aggressive behaviors there. So he did very, very well. I'm going to skip this there. Sorry. So just to kind of close up, just kind of explain to you who we are as people who practice ABA. So I refer to even though my Ph.D. is in psychology, I refer to myself as a behavior analyst. So I practice ABA. I use ABA methodology to support the people that I work with there. And so our profession, we call ourselves behavior analysts. Some of you might also be familiar with our certification, although they've changed that recently. The board certified behavior analyst, BCBA, We've got that certification as well. But I also want to emphasize that as behavior analysts, we work very closely with interdisciplinary teams there, right? So we're working with, psychologists, nurses, psychiatrists, physicians, social workers, and many, many more. So as behavior analysts, we don't work by ourselves. We obviously make sure that we're working with other members in a very interdisciplinary format there. So I want to end with this video of if you remember, this is the girl who engaged in the really severe self-injurious behavior there. This was, again, after many months of treatment. And so you'll see that she has the toys that we refer to as competing items. We found that when she had certain toys, that she would just manipulate those toys and just kind of keep herself engaged. And what we also did is started having her do very simple schoolwork, just sorting tasks. And you can see that, again, she's got her little stringy toys, so that prevented her from engaging in that hand-to-head self-injurious behavior. She has a towel because she drooled a lot. And so you can see that she's working, and it's not something that she hadn't done any schoolwork in a very, very long time there. All right. So I want to thank you very much for being such an attentive audience. This is my email address. I'm happy to answer any questions you might have, so please feel free to shoot me an email. And